There are a number of barriers that have been described that often delay or prevent access to care for women, and they are shown on this slide. And by and large, stigma is an important barrier, and I think that it's critically important that initiatives, particularly community initiatives, be undertaken to minimize so far as possible stigma. There are also barriers relating to access to care, either geographically or limited access to care by virtue of the fact that there's a lack of insurance or a lack of ability to pay. Also shown is the risks that some women may face with intimate partner violence in the event that they would reveal a diagnosis of HIV. So I think it's important. There are a whole range of variables that really prevent women from easy access to testing care, or that prevent women from actually seeking testing, and those should be considered. Specific barriers have been identified among certain groups of women, for example, immigrant women. And in this slide, a study in Washington, D.C. that assessed barriers among women immigrating from East Africa show that there were assumptions that they felt that individuals would have about them, such as they're HIV positive, even if they tested negative. There were emotions, fear of diagnosis, a discomfort about the questions. And also, there were potential reactions that are shown there, which suggested a lack of trust in the healthcare institution, and also a fear of reaction among family members. And I think just really having an understanding of the wide range of barriers that various populations experience is transgender women have a very high prevalence of HIV infection, and also have a very high prevalence of undiagnosed HIV infection, well in excess of 2 times the general population in the US. And I think, therefore, this is a really important group to consider. There are social challenges shown there. This was based on a study of transgender women that associated incarceration, homelessness, sex work, and limited education with decreased access to HIV testing. Other factors have been identified as well, such as a lack of support if a test were to be positive. And so I think that it's critically important to understand that transgender women are an important group in which HIV testing should be done, and that there may be special barriers, affecting testing in that group of individuals.